Good afternoon. It's still Thursday, February 19th, and we have our voting list for the day, and we're going to start with Amber. She's still blinking. Okay, got it.
Okay, so you have one bill in my policy portfolio on your list. It's Senate Bill 150. Finance is the secondary committee on this bill, and it's generally an expansion of an authorizing bill that we had before us previously that authorized the indication of a veteran status on someone's license or certificate or registration if they were from the Maryland Department of the Environment, Department of General Services, Maryland Labor, and the Health Occupations Boards as well. This just expands the authorization that veteran status can be put on a person's public profile, like on an online site if you're looking up who that licensed or certificate or registered person is. There was no opposition in the hearing in Triple E, and there's no fiscal impact.
Is Triple E voted?
Triple E voted unanimously in favor of this bill.
Do I have a motion for Senate Bill 150? Thank you, Senator Ellis. Do I have a second? Senator Lamb. All in favor of Senate Bill 150? Unanimous vote. Thank you.
Moving along, Senate Bill 123, which as amended and shown in the reprint before you, alters the membership of the Oversight Committee on Quality of Care in Nursing Homes and Assisted Living Facilities by reducing the number of senators and delegates appointed, removing representatives of two defunct organizations, adding a member representing Leading Age Maryland, and then specifying that representatives from assisted living facilities, to the extent practicable, should represent programs of different sizes. And so the amendment corrects the names of the House committee referenced, removes those defunct organizations, updates the name of the Maryland Association for Medical Adult Day Services, and then adds that provision providing flexibility. There is no fiscal impact. There was no opposition at the hearing.
Questions? Do I have a motion? Thank you. Do I have a second? Senator Mounts. So Senator Gowan, Senator Mounts, all in favor of Senate Bill 123? Okay, thank you.
Okay, up next is Senate Bill 394, for which you also have a reprint. This bill adds bacterial vaginosis to the list of conditions for which antibiotic therapy may be provided to a sexual partner of an individual under the state's expedited partner therapy program. So the amendment adds licensed certified midwives to the list of healthcare practitioners who may prescribe, dispense, or otherwise provide antibiotic therapy to a partner of a diagnosed patient under the expedited partner therapy program. Those providers do have appropriate prescriptive authority under the Health Occupations article. There is no fiscal impact, and there was no opposition.
May I have a motion? Thank you, Senator Jackson. Do I have a second? Senator Guile. All in favor of Senate Bill 394? Unanimous vote. Thank you.
Senate Bill 444 alters the Certificate of Need, or CON, requirement for an intermediate care facility that offers residential or intensive substance-related disorder treatment services. And so the bill specifies that a CON is not required to establish, operate, or change the bed capacity at an intermediate care facility if written notice is filed with the Health Care Commission at least 45 days in advance of the change, and MHCC finds that the proposed facility or change is not inconsistent with the state health plan, will result in the delivery of more efficient and effective healthcare services, and is in the public interest. So there are no amendments, no fiscal impact, and there was no opposition at the hearing.
I have a motion for Senate Bill 444. Senator Jackson, Senator Kramer. All in favor of Senate Bill 444? Unanimous vote. Thank Lisa.
The first bill is Senate Bill 113. It's a departmental bill that codifies the Longevity Ready Maryland Plan and requires the Secretary of Aging to lead implementation of the plan with the goals of building a longevity ecosystem, promoting economic opportunity, preparing state residents to afford longevity, and optimizing health, wellness, and mobility. By July 1st, 2029, and every 4 years thereafter, the Secretary must provide the Governor and General Assembly with an updated comprehensive Longevity Ready Maryland Plan, and the bill also makes conforming changes. There are two amendments reflected in the reprint. The first amendment incorporates amendments that were adopted by the House Health Committee, and subsequently, the House cross-file was voted favorably on the House floor. The changes are on page 3 to begin. This amendment alters the purposes of the program. And then on page 4, there is an amendment that alters the duties of the Secretary to include maintaining a publicly accessible resource on the department's website to monitor the implementation of the plan. There's an additional amendment from Senator Lamb that I'll go back to once we finish this amendment. On page 6, the amendment requires that the updated plans are informed by the State Plan on Aging and other relevant state and local plans and agency collaborations. The amendment further down on the page alters the composition of the Commission on Aging to require 3 directors of area agencies on aging instead of 1, and to add an expert on consumer protection. And then on page 7, the final change for this amendment is to add a veteran with a demonstrated interest in the implementation of the Longevity Ready Maryland Plan. And then going back to page 4, the amendment offered by Senator Lamb alters the duties of the Secretary to require them to incorporate strategies included in plans developed by local area agencies on aging and other local entities.
So, Lisa, with Senator Lamb's amendment, we're not in the same posture as the House then, right?
Yeah, that's the only difference.
That's the only difference. Senator Mouse, did I see your hand, or you're just thinking? No? Do I have a motion on Senate Bill 113? Senator Gall and Senator Lamb. All in favor of Senate Bill 113 as amended? Unanimous vote. Thank you.
The next bill is Senate Bill 336, which extends the task force on responsible use of natural psychedelic substances for an additional year, requires the task force to submit an updated report of its findings and recommendations to the General Assembly, and as amended, would require the task force to add a representative of a historically black college or university to the task force.
Do I have a motion for Senate Bill 336? Thank you. Senator Jackson, do I have a second? Senator Hayes. All in favor of Senate Bill 336? Unanimous vote. Thank you. You like the psychedelic?
Haters.
Okay, the next bill is Senate Bill 461, which conforms state law to federal requirements by altering eligibility for the Heat and Eat program within the Supplemental Nutrition Assistance Program to specify that a household is eligible to participate if the household includes an elderly or disabled individual.
Motion, please, on Senate Bill 461. Move favorable. Senator Jackson said favorable. I have a second. I'm sorry, Senator Washington said favorable. Senator Jackson is second. All in favor of 461. Do I have a unanimous vote? Thank you. All right, last one.
Okay, the final bill is Senate Bill 473, which establishes certain training requirements regarding human trafficking education for taxi cab driver's licenses, for hire driver's licenses, or state transportation network operator licenses. There is an amendment shown in your reprint. This was submitted by the sponsor at the request of Uber. this morning. It was not provided in the testimony that we had last night, but the amendment makes several changes, mainly to the requirements for transportation network operators. On page 4 of the reprint, you'll see that transportation network operators are removed from the requirements of the new section 10104.2. So that section would only apply to for-hire licenses. And it also changes the training requirements where under the bill as it was introduced, they had to take 2 separate trainings, whereas now they would only have to take 1 training, and that training should incorporate the factors of the human trafficking prevention program that they were originally required to take separately. And then on page 6, the requirements are slightly altered for transportation network operators. First, there's an exception put in that would grandfather transportation network operators who have applied for a license prior to the effective date of the bill and had completed a training that met the requirements after July 1st, 2025. And this requirement would prohibit a transportation network company from allowing an individual to provide transportation network services using a digital network application if the individual has not completed a human trafficking training within the first 30 days of after providing a trip. Originally, they had to submit an attestation to the commission saying that they completed the training, but instead this is, I guess, putting the onus more on the transportation network company to make sure that their drivers are compliant. This also allows a transportation network operator to satisfy the training requirement by completing a digital training developed by a transportation network company in consultation with a nationally recognized organization with expertise in human trafficking.
Just a few amendments.
Just a few.
I don't understand, wait a minute, I think it's page 2. Maybe not, page 4. Exempts TNOs and puts similar requirements in 10404. I don't understand what that means.
So originally, 10404 is the section regarding licensure of transportation network operators. And 10104, 10104.1, and 10106 all apply to for-hire operators. So originally, this section applied to both the transportation network operators and the for-hire, but they took out the transportation network operators from this section and put it.
Put in another section. I was afraid it exempted them. Okay. Any other questions on Senate Bill 473, Senator Washington?
The bill, we're trying to have these transportation network operators require them to create a training for their drivers, essentially, to be able to be aware of these human trafficking issues. And are they, if they do go through this training, are they required to report it? Are they required to, if they do see these types of indicators, are they then required to report it? But if they do see it and it found out later they didn't report it, are they then held accountable for not reporting it? You know, kind of like if a teacher, sees, something wrong with a student, and they held liable for not, if it's child abuse for not, reporting it. Is this kind of the same situation, or we're just saying training and that's it?
So the bill is amended for the transportation network operators. That would be training in it. They don't have to submit anything to the commission. However, the taxi drivers and the for-hire would still have to submit something to the commission. And then to answer your second question on, where is it? There's the provision at the end, it's on page 4 in item C, that says that they can't be held civilly or criminally liable for not reporting or responding to human trafficking, and that hasn't been amended, so that would still apply to all 3 classes of licensees.
But if they wanted to report it, who would they report it to?
Yeah, police. I guess there's no requirement under the bill for them to report it to a specific entity.
Yeah, I mean, just the training bill, right? Just the
Yeah.
requirement of a training that doesn't have any teeth to ensure that, these folks that they recognize that are being human trafficked are actually, can we hold it and then see if we can come up with some language to put some teeth to it?
You'd like to hold the bill? Senator Washington's
Sure.
holding the bill. Very
Okay.
good observation.
Thanks.
That ends. What was that? Yeah. That ends the voting session for today, and We are here again tomorrow at 1 o'clock for lots of alcohol bills and no free samples. No free samples. See you all tomorrow.
Discount.